Hi, my name is Dr. Jennifer Berman. I'm a urologist and sexual health expert. And I want to talk about recurrent urinary tract infections and vaginal health. Meaning every time they have sex, they develop a urinary tract infection. And this can be really stressful, really interfere with intimacy and sexuality and relationships, and is disabling. And frequently women don't or get put on antibiotics over and over and over again, and then get yeast infections and gut dysbiosis and a bunch of other things. So as women age, let's start with this reason, during perimenopause and menopause, and estrogen levels are either going up and down or declining, that impacts the ecosystem and the pH of the vagina. The pH rises, it becomes more alkaline, less acidic, which makes the environment more appealing and susceptible to bacteria, fungi, viruses, microbes, and everything else. So it's very important as you become perimenopausal or menopausal, or even before in younger women that are susceptible to urinary tract infections with sex, is that they understand the importance of maintaining vaginal health and vaginal estrogen levels. And I can't tell you how many countless women I see that come to me that have been put on antibiotics, that have been treated for something else, that all they need is a vaginal estrogen tablet or estrogen cream or estrogen suppository. It's very easy to treat. In the younger women that get urinary tract infections frequently related to sexual activity, and those women, I frequently have to add boric acid suppositories, because boric acid suppositories, there we go, acidifies the vagina and helps to prevent colonization with bacteria. So they use boric acid suppositories after sexual activity. If they're using boric acid suppositories after sexual activity and are still getting urinary tract infections, and that can happen, and we've ruled out any other anatomic or embryologic or congenital issue that could be causing things, that's the first thing we do. But assuming that they're just getting infections related to sex and boric acid suppository isn't working, in those patients, sometimes we also have to add an estrogen product and antibiotics after sex. And the antibiotic that I use is or recommend is macrodantin. And macrodantin or macrobid is bacteriostatic, not bacteriolytic. By static, I mean that it's not a strong, hostile antibiotic. It does not cause your gut to microbiome disruption. It's not associated with yeast infections. Old 90-year-old geriatric patients can take it. Pregnant mothers can take it. Young women can take it. It's a very well tolerated antibiotic that helps to prevent urinary tract infections and treat them in some cases, but really good at preventing them.